Hello friends, I'm a medical oncologist and hemato-oncologist by profession. And for me, to avoid a painful interaction with patients, the most important thing which we should talk about today is about PICC lines, which are PICC lines in short. When we give chemotherapy and we know that most of the cancer patients will require long-term care, a good venous access seems to be of prime most importance. Why do we need a good venous access? Well, this access is required for frequent blood sampling. It can be required for blood product transfusion from time to time, which may be required. IV fluids, including parenteral nutrition, which may be required to be given during the course. And of course, when we give injectable immunotherapy, chemotherapy, and injectable biologic therapy. So what are the challenges which we commonly face? Well, the most important challenge is because of repeated prick, almost 70% of all our patients could have phlebitis, which is basically inflammation of the vein. And sometimes we cannot access this vein again. Almost 1/5 of the patient, that is about 22% of the patient, may have tissue damage. And this tissue damage is known as extravasation. And it could be because of extravasant drugs, which we commonly use as a part of chemotherapy. Other than that, well, this repeated prick adds not just to the painful experience of the patient, but the entire caregivers. When they see a purplish patch in the body, which doesn't resolve very soon, it takes about 7 to 10 days to resolve. And these add to a visual impact, which is very traumatic. So what can be done to avoid such problem? Well, the answer remains a peripherally induced inserted central catheter known as a PICC line. Well, we also use chemoport from time to time, but this particular catheter is an easy insertion method in which we try to localize a good vein either in the forearm or the arm of the non-dominant hand. So if you're a right-hander, preferably a left hand, by an ultrasound guidance, where with a small prick, this line can be inserted. And the PICC line can stay for a short duration. It could be days, from months to sometimes up to an year of treatment. And what do we do with these PICC lines? Well, these PICC lines can be used for IV fluids, for chemotherapies, and for blood products. All we need is a good trained staff which knows how to handle these lines, how to take blood samples safely from this, and when the use is done, can give adequate saline flush and use heparinized saline to keep them safe and secure. A regular dressing of such lines is also warranted, in which we do dressings from within 7 to sometimes 10 days. Most of our hospitals, which are integrated cancer centers, will have a dedicated team, which includes nurses and of course, doctors and physician assistants who know how to handle such lines. One important other thing which we have to keep in mind when we use a PICC line is to have a Groshong type of PICC line. Groshong PICC lines are lines which will have a valve mechanism at one end. These mechanisms prevent reflux of blood, which can happen in the channel or in the line itself. And also it prevents air embolism. So this again remains an important complication which can be very safely addressed by using Groshong PICC lines. We have had several good patient experience who actually initially were not willing for PICC lines, but were introduced by showing other patients who had safely used these lines. And they went through the treatment rather calmly. The first important question a patient on chemotherapy would ask is it painful? Well, yes, the pain could be because of repeated punctures, and this can definitely be prevented by using a good quality PICC line or a Groshong catheter, which stays for a long time. I also want to show a video of how these catheters are inserted and maintained.